thyrocervical trunk, which you need to know. They don't necessarily come off. Sometimes they come off separately. Sometimes they cruise out along right here, and then the transverse cervical comes off of the suprascapular. But there should be two arteries heading toward laterally and posteriorly, okay, over the anterior scalene muscle here. So here they are again. Here, as they're passing through the posterior triangle here, here's the suprascapular, which is the one lower, and then the transverse cervical is a little bit higher. Okay. Traveling in essentially the same way are veins. No surprise. There's usually a vein following an artery. So there's a transverse cervical vein and a suprascapular vein, essentially taking the same pathway, except these are going to dump into the internal jugular vein rather than coming out of the subclavian artery. And there they are again, drawn in right next to their respective arteries. Okay, we're getting down there. The subclavian vein is traveling pretty much the same area, right, as the artery, except there's a big difference. Because while the artery is traveling between the middle and anterior scalene, the subclavian vein is traveling in front of the anterior scalene. So this anterior scalene muscle separates these two, so the veins in front of the artery. And then both are going to cross over the first rib and beneath the clavicle and head down into the arm. Okay. So here was that interscalene triangle, right, between the anterior and middle scalene. And in that area down there is the brachial plexus and the subclavian artery, but the subclavian vein, once again, is in front of those and in front of the anterior scalene. Once you find the brachial plexus, it's pretty easy to sort out which is the anterior scalene and which is the middle scalene. So you look for the vein in front, the artery with the brachial plexus. And we showed this before, but it's still true. The first rib with the head, the neck, the tubercle. And now that you know where these things are, you can realize that the groove for the subclavian artery is behind the groove for the subclavian vein, and in between is the tubercle where the anterior scalene attaches. So the anterior scalene attaches there with the artery running behind it and the vein running in front of it. Okay, the end is near. Okay, external jugular vein. Of all the things I've shown you before, the brachial plexus and the scalene muscles are pretty easy to see. This one is usually pretty easy to see, but you have to be very careful that you don't rip it off when you skin the neck. So lying out here, running on the outside surface, crossing sternocleidomastoid. So sternocleidomastoid is coming from the mastoid here, way behind the ear, going forward and inferiorly to attach on the medial part of the clavicle and the sternum, coursing over it from inferior to superiorly, is the external jugular vein. And as it gets, obviously, crosses sternocleidomastoid, it passes in the surface of the posterior triangle. Okay, it's a great big thing. It's a fairly big thing, usually about the size of this pointer, size of a pencil in diameter. But it is, as the name implies, external. It's out here on the surface of sternocleidomastoid, not way back in there where those scalene muscles were, where the brachial plexus is. Okay. Here are some of these supraclavicular nerves that I was talking about that we see spreading out over there. Okay, the lymph nodes. There are a series of lymph nodes lying right along this external jugular and right along the sternocleidomastoid. There's a big collection of lymph nodes in this area that you may or may not likely to see. Then there's some superficial stuff here, but then there's some deep nodes under sternocleidomastoid. So when you if you reflect sternocleidomastoid, you'll see there's usually a series of deep nodes under there. Occipital artery and vein. Okay, as it says, variably present. Okay. In a couple of days, we're going to dissect the arterial supply going to the head and through the neck. One of the arteries that heads posteriorly and goes to the occipital region. Okay, back here where sternocleidomastoid inserts on the mastoid process. Okay, there's a little artery known as the occipital artery. It's going to the back of the head, to the occipital region. Okay, it can go through sternocleidomastoid. It might be further back and go through trapezius and ends up on the back of the head. You've seen the occipital artery before. It's a branch of the external carotid, which we will dissect in a couple of days in the neck. And then there's a vein next to it that can drain to a variety of different places. But if you find it, it'll be up here near where both of the sternocleidomastoid and trapezius attach to the back of the skull. Okay, so here are just a list of the things. You should definitely find brachial plexus, definitely find spinal accessory. You will find cutaneous branches of the cervical plexus. Identify as many as you can. Supraclaviculars are really easy. Some of the others you should be able to find. The branch of the subclavian artery, it's a beast. You should be able to find that. Transverse cervical and suprascapular, you'll have to work a bit harder for, but they should be there. Transverse cervical vein. If you find the arteries, there's a vein next to it. Likewise, suprascapular. Subclavian vein is a beast. Obviously, you'll find that. It's right in front of the anterior scalene. External jugular, you should find, but be careful that you don't pull it off with the skin. And then these are a little bit more challenging, but do your best. Okay, again, short lecture. Remember that you are trying to dissect on both sides, okay? And then you'll have a better chance of finding all these wonderful structures. There's no lecture on Friday, but people will be in the lab starting at 1 o'clock. If you want to finish up your dissection there. Monday, we will be back in here. We'll be doing the anterior triangle.